Hello, you guys.
Hi.
How you doing?
Pretty good. How are you?
I'm good. It's a pretty nice day, not too sunny, but not too cold. I was doing some work and then I took a, sorry about that, nice little walk. How is the material for you guys?
I haven't started the stuff that's due this Sunday, but I really enjoyed last week's stuff.
And that was what, the facial?
Yeah, the facial muscles and then the axial skeleton.
Okay. That's kind of what we're doing today. Do you feel like you understand you understand it?
I do. Yeah.
Okay, that's good. And is it oh, sorry, I don't know how I can turn off that little zing 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 thing. And is it the process is okay to do it the way we're doing it? It's not too boring, I guess I should say, ask.
I mean, I'm not bored, but I'm finding the bio type sciences to be increasingly more interesting in the past month and a half. So I feel like I'm also in a physics class, and every week I find it increasingly less interesting. So I feel like I'm biased. I don't think it's boring personally, though.
Good. No, I mean it's I'm taking the Bio 2 class now, and it's a lot of just book reading and a lot of it is about the language of how questions are phrased and stuff, and I feel it pretty tough. It's not an easy class to figure out what is wanted, not even just going straight what the topic is about. And so that's why it's always very important to me that we make the classes as enjoyable as possible as we can, right? So the interest is there, and it's about our own body. It's a pretty important piece of the equipment that we have to go through life. Anybody else have some comments while we're just checking in? How is the class for you guys doing? That's sort of my question. Do you have any challenges, any questions to the process? Silence. Nobody? Anybody? No? All right. Well, let me start taking some roll then. If you have anything that comes up, just interrupt me, and we can talk about it. I'm going to go through a few things that I have on my agenda. Let me take some roll though first while we check in. I have, let me pause this real quick. Okay, so there's a few things that I want to do in terms of announcements things. I did everybody get my text with links to atlases that you can download, like anatomy books?
Yeah, I got it.
Okay, yeah, good.
Yeah, I got it too.
That's some cool stuff. So if you haven't gotten it, you see my canvas?
Yes.
I think I have good. Where do I put it? Somewhere. I put it somewhere. I think I also put it behind here. Links to anatomy atlases. I also put it behind here. So in case you need accesses. So I suggest you download some of those onto your computer or whatever you're using, or tablet. And then I thought I had one up here. I have one up. And then you work with at least I would, if you're interested in this kind of stuff, at least I would download one of those atlases. And let me just show you briefly how they look. So this one is, you can see that, right? Frank Netter on top here. You see that?
Yes.
Yes.
So this atlas is sort of the classic in America. This is the guy who wrote it in the whatever that was, or draw it. He was a very good painter, and he was a medical doctor, and even through school he was drawing stuff, and so he became sort of the main you know, look at this picture of the skull. How beautiful is that? I mean, sorry, I'm a little nerdy about it, but look, you see all the stuff very clearly delineated, what is what, and labeled. And so that's what you get out of an atlas like that. So that's this guy's, the Nether one, you know, very nicely drawn stuff, very, very, very visual. I really like his work a lot, and this is the basic atlas that if you go to a medical doctor and they talk about anatomy, that's what they kind of reference and what they usually use. So that's that text, and then so that's the Frank Nether. I think that's the first one under the threes, and then I have this one. Let me share this with you. This is one of my favorites. This is a German text. And the Germans are, there is something engineering about the Germans. And see, one of the things that I really like about this atlas, for example, see here, this is the muscle as we dissect it and then we learn it. This is the front of the chest. And so it's nice. You could see the attachments and all that, but then they decide to draw it so you really can see the attachments of where it goes onto the bones. And so it has this, you know, engineering type exactness to it, the way that text is drawn. And so that's the second link. I personally like that as well very much. But again, you know, they're all depicting the same thing at the end of the day. And then the last one that I think I have as a link there is going to be this one. And that is different. Sorry, I showed this like the face. It's not like the nicest thing to see. But that atlas is cadaver pictures. See here? And then you have these numbers and these labels, and then you have the what they mean over here on the side. And so that's a really very exact, of course, atlas. Is extremely well done. Of course, if you can't handle cadavers, never mind. But you know, it's really well done, and it's very exact. And so those are the three that I go to and utilize. There's also textbooks, but I prefer atlases for, you know, looking up structures. Because a lot of the text that is in the booklets is sort of the extractedness out of the anatomy textbook. It just took away all the fluffy language. So that's the atlases. So I want you guys to, I mean, you don't have to, but if you have interest, use it to find things that you might have a question about. You know, Google is also a good resource, but a Nether, for example, is, you know, you have everything there. It's definitely a superior product, I think, if you think of it that way. And then the other thing is we're starting a study group, or some of the students are starting a study group. I sent some texts out. I hope you got some of my texts, and the feedback I've gotten from the students, I've created a group text that then everybody can talk to each other, and that's been working pretty well. So if you want to be part of the study group or one study group, just shoot me a text. And then I connect. That seems to work pretty well, Celeste, right? No. Okay. And then, you know, we can add you to that group text. And what I've done is here under the, you can see my my canvas, you guys.
Yeah, we can see it.
So here, see here, there's student study group. And so when you press this link, it goes to a external link, and then it goes into a room that is always open, that is always active. And so you guys can just like connect and say like, hey, we want to meet tomorrow or whenever, and you talk to each other, and then there is that possibility that you just go to that space. And of course, if you want to, you can also feed me in and say like, hey, do you have time to answer some questions at such and such time or so? And you know, if I can make the time, I'll do it, or we find also time that works. I have enough flexibility. So I think that we want to explore how that works for some of you that like to do study in some groups. It's pretty good to do that with, you know, the material that we're going through. You can quiz each other, you can answer each other sort of and questions that you're not quite sure about. I think it's a very good format. but we'll see how it goes. So that's the study groups. And then the other thing I want in the announcement is when you do the homeworks, make sure you label the terms on the term list. All of those terms on the term list, I want labeled on at least one picture. You can label it on multiple pictures because some of the terms are, in the skull, we have a side, we have a back. Some of the terms show up on 2 or 3 pictures. You don't have to label them all on all the pictures, but at least on one. If you do, of course, it probably helps you with the studying, understanding, because you look at something from a couple different angles, but it's not mandatory, but at least one time. And then I want you to color with, you can use, Sharpies if you want, or any other color or pencils. Take some time if you make it a little meditation, but spend a little time with each term and try to help. Should help to absorb it in the memory. And then if you have it all them labeled and colored, then you upload it. If you don't have all the labels, I do some spot checking on that. I don't check all of it. That's too much, but I do some spot checking. If you don't have all the labels, I take you some points off. If you don't have the coloring, I take half the points off. And then if I do that, you can redo the work, upload it again, and then I give you the full credit. So it's not, it's not like it shouldn't be a punishment. I just want to have you I want you to go through the process. And after a few laps, everybody kind of knows how we're doing it. Any questions to all that? Well, you are easy going. No. Yes, please.
Oh, I was just responding no.
Oh well. Well, if that's the case, that hopefully is an indication that everything is fairly smooth. Oh, if you have an assignment like a healthcare assignment, like the food labels or so, some of you haven't done that yet and you're late, just shoot me a text. I have no problem opening it again. I don't want to be too gruff on that. I mean, I want to make sure you don't fall behind too much. But something like a health kit exercise, just shoot me a text. I'll open it again so you can upload it. Make sure you don't just put it to the side and get the points that you can get if you've done the exercise. Good. So with that, I would like to, again, if you have any questions, interrupt me. But if we don't, then I would like to make sure before I move on, did I have everybody's on the roll? Did I call everybody's name, or is there somebody who added later? I don't think so. All right,
I came on a bit later.
Oh, there you go. I see that. Yep, super. All right, I got you on the list too. Perfect. Thank you.
Okay, thanks.
Okay, then what I'm usually doing this section is I go through the terms of the term list and show them in the booklets, and we can talk about them a little bit. We can talk about other terms as well. I want you to ask as many questions as come up, and then we usually after that do a little practice test, little practice quiz type thing where I work with you like it's kind of a test environment, and so it doesn't count. It's just for practice, but that way by the time we get to the test, you all kind of know how everything works. Okay, so can you see my mocking with muscle thing?
Yes.
Good. So when I go through mocking with muscles, I first describe facial expressions, so hopefully it wasn't the most boring chapter, but the names are sure interesting, aren't they? When I start with mocking with muscles on this slide here, which is kind of how your textbook is made, is from the slides. The muscles are usually, the facial muscles are a little different, but I have the introduction here because we have some of the muscles in the face, the chewing muscles, that behave like that. So usually muscles that move our bones around, our limbs around, our body around, are attached to bones. And they are attached at two ends, the top end and the bottom end, or a side end and a lateral end or a medial end, but usually two parts. And the only thing a muscle does as a function is it contracts. And when it contracts, it pulls those bones that are attached, that is attached to it, pulls those closer together, and that creates movement. And so we then need to describe one thing in a muscle that we need to describe is the attachments. And the attachments are described as origins and insertions. And an origin is an area of the stable region of the muscle. So if I flex my elbow or bring my elbow up, the origin is the shoulder attachment, because the shoulder doesn't move, the elbow moves. And so down here, the muscle is attached to the forearm bone, to the ulna and radius, and that is actually the radius mostly, and that is then the insertion, because that's the part that moves. So that's the second bony attachment. And then when that happens, when the muscle contracts, and again, a muscle just can shorten, that's all it can do actively. When it then does that, it creates an action, and the action is described on that action is the movement that is happening, and that's what is described in there. And then a lot of times, another thing that we want to describe in a muscle is innervation, because each muscle is fed by a nerve, because the skeletal muscles, which are these muscles that are attached to the skeleton, are conscious. So they're willfully moved. We willfully move our hand and bend the elbow. So that's a muscle then that needs a nerve innervation that's connected to the brain. And that is described as innervation. So which nerve goes to it, which motor nerve. We'll talk about what a motor nerve is a little bit later. We do not go into that too much, because it just becomes sort of an endless list of muscles and what is the nerve and all. And so it becomes really difficult, I think, to study it. What I want you to mostly learn in these chapters that it goes through muscles is what's the muscle called. If you grab where it is, that's kind of important as much as we can learn that. And then, you know, origin insertion is great and action is great to learn. And I have exercise in the homework, but as it comes to the exam, I only want you to be able to identify it. So you don't have to know all of these details. That would be more something that you can look up. And it's more for me important for you guys to understand. If you study further, you know, massage or I don't know, whatever stuff that has to do with this or in a different class, sometimes they go a little bit more for these attachment sites or the nerve innervation or action. But in my class, you just, for the test purposes, you only need to identify it. And what you need to identify in my class, just I want to reiterate that over and over when I do the test. The second test is a lab test, and I point to things and you need to tell me what it is. And I basically ask you for bones, which are full bones. I ask you for landmarks, which are parts of the bone. And I ask you for muscles, only those three things, nothing more than that. All right, so then the first muscle that's on the list. And so if you take your term list, you have the third column in the middle, it says muscles. So that's where we start. That first batch is facial muscles. So we have the first one on there is the frontalis muscle. So you see that muscle is right here in the front. So that's overlaying the frontal bone. So that's hopefully memorable to be able to identify it. These pictures down here, I have pretty much for all the muscles. When I find it, I put these sort of tension point pictures or trigger point pictures. But these are like, if you have a tension point in here in this muscle, it can create you pain in these areas. If you have a tension point that's really in the back here by the, we study frontalis muscle, but actually there's one in the back as well, and it's actually connected. So sometimes this back muscle is considered part of that whole muscle as well. And if you have a tension point in here, it can give you pain in this area or even in the eye socket, and translate it to there. And so this is, you know, just some interesting, more applicable data that, you know, something, if you like to massage, for example, you can help people by kind of knowing these patterns. So that's the frontalis. And again, if you have questions, just speak up, please. The second one is the Corrugator Supercilii muscle. And when it comes to the test, you have your term list with you, and well, you have the booklets with you too. It's an open book test, but you know, I want you to have the term list really there as the front piece of paper, because you're only asked for terms on that term list, and I basically want you to copy it onto the text box as well as possible, so the computer recognizes it. Makes my life easier than if you misspell everything. But if you misspell it, it's fine too. Don't worry about it. Don't get too freaked out about that. It's just that the system might recognize it initially as wrong, and I have to go correct it in the back. And so just be aware of that when it looks like your score is not high at all. I took a lab test in the Bio 2 class, and my initial lab score was 26 out of 50, and I should know that stuff. But it's all misspelling stuff, so it's not like, you know, so don't freak out if that's happening to you. And students have gotten better and better at that understanding. So the corrugator supercilii muscle is in between the eyebrows. So it's this muscle there in between the eyebrows. It's actually the muscle where Botox is injected to, so we don't get these lines, these up and down lines we don't think are so cool looking. But the problem is when we do that, the eyebrows come forward a little bit, and it helps us with the glare of the sun. So if you have Botox injections, you got to be understanding you can't do that no more as well. So just be aware of that. It has consequences because Botox is a toxin that gets injected, so the muscle doesn't work as well anymore. And sometimes that's very useful. So that's a rather complex termed muscle. The next one that's on the list is the Orbicularis oculi. And orb is a round structure. So Orbicularis is a round muscle. And we have one around the eye socket. And then we also have one around the mouth. And so we have an Orbicularis oculi. Oculus is the eye. And then an Orbicularis Oris, if you look further down on the list, and that's around the mouth. Good. So far, so good?
Yep.
Good. Then we don't do the eyelid muscle. That's the levator palpebrae superioris. We don't do the Elvis muscle, the levator labii superioris aliquinasa. Isn't that a beautiful? That's the longest name there is. So it's going to go downhill from now. A small muscle is such a name. But we will have on the list, we have the nasalis muscle. And hopefully that's, you know, one that you can remember quite easily because it's the nose. It's nasalis' nose. And then we get into four muscles that raise or and lower the lips. And we have two on the top and two on the bottom. So two muscles raise the lips and two muscles lower the lip. We each on the top and on the bottom, we have one muscle that's sort of attached to the lip itself. And then we have one muscle that's attached to the corner of the mouth at the end there at the lip. And so the one that's attached on the lip itself and goes upward is this one here, goes towards the eye right here, is called the levator labii superioris muscle. Levator means elevate. Labii means lip. And superioris means above. You've learned that. And so that's that one. And so then we have another one that comes from the corner of the mouth. And on the top part, it's not called levator anguli, whatever, superioris or something. They labeled that the Zygomaticus muscle. And so the Zygomaticus muscle goes from the corner of the mouth to the zygomatic bone, the cheekbone. And so when you see that, so when you need to make out these muscles on different models, sometimes they are looking different on different pictures. But you have what you can go by most is the attachment side. And so if you have a muscle that's attached to the lips, goes upward, that's not going to be the corner of the mouth, that's the lip. So that's probably a labii muscle, not the Zygomaticus muscle. Where it gets more pronounced is when we go to the bottom. See, we have a muscle here, and that's then a little bit further down on the list. Is called the Depressor labii inferioris muscle. So depressor means going down, depress. That levator meant up, depressor means down. Labii means lip. Inferioris means in the lower end. So it's the lower part of the mouth. So that's right here from the lip here going downward, not to the chin top, not to the side of the chin, but from the lip downward. You could see it also here indicated on this picture. And then the Zygomaticus on top, on the bottom, becomes the Depressor Anguli Oris muscle. You see that here, Depressor Anguli Oris. So when I look at the picture, you see it goes from the corner of the mouth downward. And so that's then the Depressor Anguli. Anguli stays for angle of the mouth. The corner of the mouth is the angle of the mouth. You know, it makes like an angle, an acute angle here. Unless when I'm screaming, it's an obtuse angle. Anywho. Does that make sense, those four muscles?
Yes.
No?
Yes.
Yes.
Good. Tell me when I put you to sleep, okay? It's a monologue over here. But we get through it pretty swiftly. That's also good. Then we have the Boxinator, and also, if you go further down on the list, the Risorius muscle. Those are on the side of the cheek. So the Boxinator is deep, a deep muscle on the side of the cheek. If you have babies and you have nursing infants, those muscles are developed like crazy. That mouth in a baby is just like a hose, so it can suck. And so these muscles do that work, and so they're very strong. They're also the muscles that create the dimple on the mouth, on the side of the mouth. So that's the Boxinator. And then the Risorius muscle is, the Boxinator is deep, and the Risorius is sort of a sliver on top of it. That just lays on top of it. It's a small little muscle here on top. That's the Risorius muscle. So those kind of go together there. And then the Orbicularis Oris is around the mouth. So if you look here, this is a good picture, shows all of them. Orbicularis Oris is around, and then the Depressor labii is here down, going downward. The Depressor Anguli is on the side and the angle, and then the Zygomaticus and the levator labii superioris starts from here going upward. It doesn't show it here that well, but you know, on the model that I use, it shows it okay.
I have a question.
There you go. Yes, please.
Is there any information as to who created these names for these different muscles?
No. That would be interesting, wouldn't it?
Yeah, you know, I'm just kind of wondering how they were able to come up with these different muscle parts, and if it's
related. I mean, yeah, they probably had a lot of wine when they did that. But I mean, you know, a lot of times, I mean, the muscle, it's actually interesting when we get into the different kind of muscles, you know, there's different things, different naming things. So one is like, what's the direction of the muscle, like a rectus or an oblique, or a, you know, that's the part of a name, or how does the muscle look? Like a trapezius looks like a trapezium figure, or where is the muscle attached? That's also often in the name. Like the muscle here is known as the sternocleidomastoid because it says where it goes. And so we can make a lot out of, or the muscles on the side of the neck are called the scalenes because they're slivers and they look like the scales on a fish. And so that's kind of interesting too. But yeah, we have some rules like that, but it's basically just here to make sense of what we could consider quite random, the way that they made up these names, you know.
Right. Okay.
Go ahead.
Oh, no, I was saying just thank you. Thank you for answering the question.
Oh, yeah, you're welcome. You're welcome. No, well, and I said in our Monday class, what's interesting too is we have, like in the massage world, or actually the musculoskeletal healing arts world, in the last, I think, about 20 years, something called fascia. I don't know if any of you know about fascia. When you like the muscles attached to the bone, and that's the white tendons, and that's sort of fascia. Those are like pockets where the muscles attach to bones, and then they go all the way through the muscle. We just can't see it, and the muscle sits inside a pocket of fascia, and the fascia attaches to bone. And so there is this theory, and it's not just theory anymore. It's pretty substantiated, like that muscle fascial connections go throughout the whole body. And one of the main ones we have is in the back. So you have one connection go from the sole of the foot up the calf in the back, up the hamstrings in the back to the butt, and then up the spine, all the way the neck to the front of the head. And that's one connection of this dense, you know, tendony type tissue. And you notice when you step off of a curb and you miscalculate the distance and it sort of jolts you a little bit, that's when you feel the fascia contracting. And there is arguments that says like, well, you know, these muscles are fine, these names and all that, but it's really these fascial connections and the muscle tissues just sits in them. So the names are sort of then almost a little arbitrary, you know, then even more arbitrary in some ways. And so it's interesting, you know, that kind of stuff. But, you know, I'm a nerd, so it's interesting to me, of course. You start making me talk about it. Anyway, does that make some sense though?
Yes, it does.
Good. Yeah, no, the more knowledge that I can give you about those kind of things from also the, you know, the practical world, I think it helps put into this, what does what really mean, you know, in terms of later on. It's not just theoretical knowledge, it's actually something that is usable later on. So then the last muscles on the list that I have there are the chewing muscles, and the chewing muscles have to do with opening and closing the jawbone, and mostly closing it because it sort of opens passively by falling down. Or we have some muscles in the front here, the platysma, for example, that pulls it down a little bit, but it's not as much of a force necessary than if we're actually chewing and needing to grind some food or tear some meat off a bone or something like that. And so we have a few muscles that do that, and we have two of them on the list, the temporalis muscle and the masseter muscle. So if you look at the jawbone, remember the mandible, if you did that chapter, it has it attaches to the skull back here in the condyle, but then it has this coronoid process in the front that sort of sticks up. It sort of dips down and then sticks up again. And that's a place where the muscle, the temporalis muscle, attaches to, and it goes from there and goes onto the skull in sort of a fan-shaped direction. And then when it closes, it puts a lot of force in this direction. And so it has, you know, a little multiple directions, but it's mostly this diagonal up. Because then the second muscle we have is so that's the temporalis muscle. So that's by the temple of your, you know, of your skull, sort of, or the temporal bone. It overlaps the temporal bone a little bit. So that's the naming there. And then the second one we have is the masseter, and that's attached to the zygomatic arch here. You can see that better there. And then it reaches down. Actually, this whole thing is the masseter, and it reaches down and attaches to the ramus and the angle of the jaw, of the mandible. And as it closes, you can see it closes it a little bit more in this direction, not so much in this direction. So we have these two really big forces that we can close the jaw with. And so that's the masseter, this one. And then we have, yeah, see, we have all these little small ones. We have a whole bunch of stuff in there.
I have a question.
Yes, please.
The temporalis somehow connects with the jawbone, like the mandible, it seems like.
Yes, exactly.
Okay.
Right here. See that bump?
Uh-huh.
Right there. If we look at the skull, I don't have the skull slides up here, but I can pull them up if it's not visually enough. But you see the skull, the mandible has the condyle in the back that attaches to the temporal bone, and then it goes forward here on top. It reaches down a little bit, but then it has a little thing sticking up here again in the front, a little piece of bone, and that's known as the coronoid process, and that's where the temporalis muscle attaches to, and so it attaches to that jaw.
Okay, because that's kind of hidden, but now that you mention it, I can see it. Yeah.
Yeah. It's not that easy to see that. And I don't make you study the coronoid process because it's just too many names. And then it goes up into the side of the skull, and it pulls it sort of underneath, you know, it pulls it underneath the cheekbone arch there. When you have the cheekbone, you go back towards the ear, that arch, that muscle goes underneath that arch. And then
that's amazing.
It's pretty cool, right? Yeah, it's even cooler. The next ones are even cooler, I think. It took me forever to start working on those on patients, but if somebody has TMJ problems, it's great to work on those muscles.
Yeah, I had an experience with a chiropractor who went into my mouth.
Yeah, I do that in the mouth.
That's a crazy thing.
Oh, it's heckin' crazy, but it totally works. I mean, it's amazing, and it's really actually very easy to do. You just have to do it, and a lot of it is knowledge. So anyway, then the masseter is attached. Sarah, the masseter you got where the attachment is, right?
Mhm. Yeah.
Okay. And
Thanks.
so those are the two ones I want you to study for the test. But then we have two more, and they are on the inside. And if you look at this, is the skull from underneath. This is the mandible here. And there's one that's attached on the inside of the mandible and goes up to the back of the roof of the mouth, which is actually the sphenoid bone at the end of the day back there. And then that's the one that you work on the inside of the mouth. So you stick the finger in here, you stick the finger between the teeth and the jawbone, and you have the patient close the mouth, and then you push with the finger against this muscle. And, it actually hurts quite a bit. Although I don't know, I haven't done it on myself. But, and then you turn it around and you work this little muscle here. There is a fourth one that's attached at the maxilla. No, actually, it's also the sphenoid bone. It looks like it's the maxilla. And then it goes to the jawbone. When that contracts, it pulls the jawbone forward. And that muscle is the lateral pterygoid. That helps with opening the mouth. So when you open the mouth, it's sort of the jaw comes forward slightly and then the mouth opens. So yeah, there is a lot of theory that people that talk about in car accidents with whiplash. Those jaw muscles are usually impacted somehow. And if somebody has TMJ, it's kind of a problem. But when you can't close your jaw, it hurts like crazy when you do it. Anybody had experience with TMJ? No? Well, that's good. I used to have night grinding things going on. And so that was my problem. All right, so that's the facial muscles then. So from there, we can go to the axial skeleton if people are not having questions. And the axial skeleton is right here. So what I want you guys to know, so that now we're going on the terminus to the first column again at the bottom below the skull. And so when we look at the axial skeleton, we're looking basically at you see the axial skeleton, right?
Yes.
Okay, so basically we're looking at the spinal column, the sacrum all the way down, because that's also spinal column at the end of the day. And the skull we already did, and then the inner ear bones are attached to the skull, so they're part of it. And the hyoid bone here in the front is part of it. And of course, the rib cage and the breastbone in the front, all of that is part of it. And then as soon as we go to the shoulder blade and the collarbone, that's then considered the appendicular skeleton. And down in here, the hip bone is also, the pelvic bone is also considered appendicular skeleton, or the extremities basically is what that means. We have 24, yeah, look at that. You can see all my stuff, how I created that. We have 24 vertebrae, 7 on top, 12 in the middle, 5 on the bottom, and then the sacrum and the coccyx. And these are these little ring-shaped, weird, irregular-looking bones that stack on top of one another. They're kind of like donuts in some ways. Has a hole in the middle like that. And so when we name them, we have 7 in the neck area, and even a giraffe has 7 of them. So they're just very big in a giraffe. We have 7. They're from C1 to C7. So when we name them, we name this. The neck is called the cervical spine, and we name them after cervical spine. C for cervical spine. So we got 7 there. Then we got thoracic spine is a mid back. We got 12 vertebrae there. And then the lumbar spine is a low back, and we got 5 vertebrae there. And we call it T12 to T1 to T12, and then L1 to L5. The sacrum is fused vertebra, so we don't need to worry about labeling. Well, actually we do. We call it S1 through S5. I don't have it indicated here. That's more when you need to go specific landmarks, for if I do my work, sometimes it needs to be, what level is it? And so they call it S2, S3 or something like that. And then coccyx is just the tailbone. That's really rudimentary fused vertebra together. They definitely don't get a labeling system down there. But for you guys, C, T, and L is plenty of fine. We have these curves, and you look from the side, you have a curve in the neck that goes back, that sort of rounds backwards. And then in the mid-back, it goes forward. So you get a hunchbacky type. So if it's bad, it's a hunchback, that kind of curve. And then the low back is kind of goes back again. If it's really bad, it's a sway back kind of thing. And so we give these curves some terminology. The neck and the low back is the same direction of the curve, and the mid-back and then the sacrum is the other direction of the curve. And so in the neck curve and the low back curve, we call a lordosis. That's the term for that curve going backwards. Also, the other term that they use, and if that's too much info, then just sort of put it to the side. I'm not testing you on this, but the other term is used is called a concave curve. And the term concave, I remember it like if you look from the back, it looks like you're walking into a cave. That's how I remember it. For the life of me, took me forever to remember this name. And so I want to just mention it so you're exposed to it and maybe give you a little tip how to remember it if it comes back in another anatomy class. So that's the terminology we use for the neck curve, the cervical curve, and the low back curve. So they're both lordoses and they're both concave. And then in the mid back, the curvature that you use there, or the name that you use there for that curvature going backwards, the hunchbacky type, is kyphosis. And then that's a convex curvature going outward. The place where you probably heard this terminology potentially is at the ophthalmologist when it goes about glasses, how they are shaped. Are they going inward or going outward? They call them convex or concave. And so that's where that terminology is also used. And then the other thing I think on this picture that is helpful is to understand between each of these vertebrae, we got an intervertebral disc. And the intervertebral disc is, if you remember back to the tissues, faintly, a few weeks ago, it's fibrocartilage. And so it's an interesting structure. It's a very tough meshwork of fibers, like, how a fiberglass sort of meshwork looks, like a surfboard or something like that. These fibers that are interlaced and they create a mesh that's really strong. And it's kind of like that. And so you got a lot of collagen fibers that attach from the top vertebra to the bottom vertebra and make a shell around each of these vertebrae and an encasing. And then on the inside, there is a little gel that moves around. It's like a motor gel structure that in the morning when you just start to stretch yourself, that's kind of thick and unflexible. That is actually a thing if you don't feel flexible in the morning. And then as we move it, it becomes a little warmed up and it gets more and more flexible, that inside gel structure. And that's the intervertebral disc. So if you heard of a disc injury or a blown disc or stuff like that, that's what we're talking about. That maybe something broke in one of those fiberglass meshwork type of structures. They call that part the annulus fibrosis, if you're really nerdy and want to know that term. And the inside gel structure, they call that the nucleus pulposus. It's kind of a cool word, actually. And if it's really bad disc, that's when you need surgery, is when the disc breaks and the gel squeezes out and pushes on the nerve, and that makes you like not be able to use your legs or arms, for example. Then you kind of need to go in with the surgery and take that fragment out and make sure it's not pushing on the nerve and killing the nerve over time. So that's, sort of in short what that's all about. And then they use a lot of complicated terms of what they're doing with it. The other thing here is interesting is the intervertebral foramen. So if you stack the vertebrae on top of it from the side, you're going to get a hole in between each of these vertebrae. And that's the intervertebral foramen. And what comes out through there is the nerve that the brain is attached here, and the spinal cord travels inside that column down. And on each section, one of these nerve comes out, and that's a spinal nerve that comes out. And so that spinal nerve is then a nerve that goes to the muscles and talks about talks to the muscle, and the brain can communicate with the muscle and say like, I want you to contract this now so we can walk and do stuff like that. It's kind of interesting, this whole thing. And so when we figure out, you know, which muscle gets the nerve from which section, then we talk about which hole do they come out, and each hole has a name. Actually, the names of the holes are pretty much the names of the vertebra that they come out in between. So you don't need to worry about those differences too much, but I want you to get the general concept of it. Oh, and I have to get moving here. Okay, then the only thing here is this slide is the secondary and primary curves. The primary curves are the mid-back and the sacrum. They are made in the womb. And as we start holding up the head and then walking or standing up as we grow, then those secondary curves, the neck lordosis and the low back lordosis, get created. This is kind of an important piece that when you have kids, you don't necessarily want to force them to walk. You want to wait till their body is ready to do that, because that curve needs to be developed for it not to be too much pressure on the spine. So that's something to be told to some of the energetic parents that I've also been once. All right, so let's go to the vertebra itself. So when you look at the vertebra itself, this is a generic vertebra. It is not one that looks exactly like that in the body, but it has all the pieces that we need to worry about naming. So the main structure, oh, this is the front here. Anterior is front. So this is, you go through the body, through the gut and through everything, and then come to the front of the spine itself. And that what you first touch is the body of the vertebra. And then you go backwards towards the back, and you have these two columns of bone coming out, and they are called pedicles. And then from there, they come backwards and towards the midline again. And at that point, they're known as the lamina, and then they fuse together in the back. And there is a little bony process that comes out, which is actually the thing you touch when you touch the back of your spine. And that's the spinous process. And then the only other term there, what we need to worry about is the process that comes out on the side. For also processes like that are bony outgrowth like that is usually for muscle attachments. Sometimes it's for joints too, but muscle attachment is a big one. And that's called the transverse process. So on all of these things, you've got a whole bunch of weird muscles attached to it. And then so that's what's on the list. What's not on the list is these articular processes here. See here, superior articular process and facet. So when you look from the side, this is hard to see from the top of the vertebra. When you look from the side of the vertebra, you see how there is a little piece of bone that goes up here. And then from the top where there's a little piece of bone that comes down. And those are these side bars that go up and down, and they form joints with each other. So when it says process here, it means the bony part. When it says facet, it means the joint surface that creates an articulation, is a joint. And so those are also parts of the bone that are very important, because they actually help the movement. They glide the movement of the spine, of the spinal cord, and they also carry some of the weight of the whole spine of the body down the spine and then goes into the hip. But I don't have them on the list because they're hard to make out, and I don't want you to feel confused. Is it the pedicle or is it, I don't want to make it ambiguous. And from there, we then go to the top vertebra. The top vertebra is the atlas. The atlas is a ring-shaped vertebra. So it's the only vertebra that does not have a body. Everybody else has a body. And below the atlas is C1, but it has its special name given before they did the C1 naming system, and this name stayed. And it's from the Greek mythology, where the atlas, the atlas carries the world around, and for us humans, our world is sort of the head, or at least that's what they thought then. And so that's what the atlas carries, is our head. And then the second vertebra is known as the axis. And the reason why it's known as the axis is because it's got this thing that goes up and down. So this part here at the bottom is known as, is the body of the axis, but the bony process that sticks upward, which is known as the dens. And dens means tooth. This bony process then articulates with the you know, when you bring these bones together, they sit on top of one another, and it articulates with C1 and creates this axis that then C1 can rotate around. And so a lot of the rotation of our head, the nose saying kind of turning, the turning comes from this joint right in here. The nodding, the up and down nodding comes, a lot of it comes from these joints here. If you can see how they're laid out, they're sort of hollow, and then the skull sits in them, and we can sort of rock the head up, make a bubble head out of it, kind of thing. Good, so that's that. And then we have these different sections of the vertebrae, but we're not worried about pointing out on the test, pointing out the differences. I have you do that in the lab portion, pointing them out real quick. In the cervical spine, we have a hole called the transverse foramen, which is a place where we can carry the vertebral artery in. Where is that hole? Transverse foramen. Huh. I should label that too. Why isn't that labeled? This hole here is known as the transverse foramen. So you might have to look that one up. I think I talk about it in the video for sure. It took me by surprise here. I thought it was labeled. But anyway, that's a specific thing. It's oh, here, at least I put it down here. Transverse foramen. And then the other thing is the back here. If you look at the spinous process, it splits a little, and they call that bifurcated spinous process. That's in the neck. As it comes to the mid-back, the unique features is the fact that the ribs attach to the mid-back. And so we have these facets. The facet is a term we use for a sort of a fairly flat rib surface for a joint. And so we have the costal. Costal refers to rib, a costal facet on the transverse process, and then we have two of them on each of the bodies. Because what happens is the ribs, they come into the body from the front to the back, and they attach to the transverse. And then on the body, they attach in between two vertebrae. So they come in between them. So we have a little bit of a joint on the top vertebra and the one on the bottom a little bit, which can be a problem, because if somebody has a rib, I don't know if you ever had that. It's like you get a pain in the back that's sharp, like somebody put a knife in your back. If you ever had that kind of pain, then you know it's a rib, that sort of something is caught up somewhere here, and it's kind of like skin of the rib thing is pinching, and that pinching hurts like crazy. And so then we have to show you how to pop the rib back, but we can't do that on Zoom. It's actually not that hard. So that's vertebra. And then in the lumbar section, the vertebra is just big and has a wide spinous process, a long one. So you can sort of, if you have to, like, you know, if you have bones on the table and it's like, which one is from the lumbar spine, for example, in a different class, then you could figure it out, because, you know, this looks like so big, it's nowhere else to be found. All right, but that's not on my test. On my test, what comes next is the sacrum. And the sacrum, a few terms of that. The sacrum is the bone between the hip bones and the butt, which is kind of where if we slouch, we're sitting on the sacrum. If we're sitting up straight, we're sitting on what's called the sit bones. And the sit bones is in the appendicular chapter. That's part of the pelvis. That comes up next. But the sacrum, I need you to know that that's that bone. And then the other thing I need you to know there is the terminology is there's a wider surface on top that's known as the base. And then on the bottom, it comes to a tip, and that's known as the apex. And then the other thing there is the fact that it has transverse lines in the front, looking from the front. And these are the remnants of the intervertebral discs. And then in the back, it has a ridge. And these were the spinous processes that are fused together. And we call that's the medial sacral crest there. All right. So that's all I needed to know for the sacrum. Don't worry about all these other terms there. We can put them in later. There's plenty of what we're doing already. Then we have the breastbone is the next item. And there on the breastbone, we have three parts to it. We have a top portion that's right underneath the jugular notch. There is where the throat is, right underneath there. And then when you feel on your own breastbone, there's a little bit of a bump some in the middle. And that's the sternal angle. But underneath there is what's called the body of the sternum. And then below that, where the ribs come together, there's an area that's very sensitive. So when you push on it, be very gentle. And that's known as the xiphoid process. That's actually a muscle attachment. We'll talk about that later. And then when we talk about the ribs, we have 12 ribs, and we have 7 of them are known as true ribs because they are attached. All the ribs come from the back and they go to the front, and then they have a piece of cartilage in the front that connects the rib to the breastbone, which is helpful because it gives you flexibility. But of course, cartilage is softer than bone, so it's also a little more vulnerable. So we have to also, be mindful of that. If you have like a seat belt go across here, you have a car accident, often some of these ribs get a little disturbed. And so if you have pain in here or anything, it could be that some of these rib joints are a little bit off. Anyway, the first 7 are directly, the cartilage goes directly from the rib to the sternum, to the breastbone. The next set of ribs, below the 7, the 8 to the 12, those cartilages don't attach directly to the sternum. They attach to another cartilage, and then the cartilage number 7 carries all of them up to the sternum. And then the last 2 ribs are also known, they're false ribs. All of those, the last 2 are also false ribs, but they're also known as well as floating ribs because they don't have any cartilage at all that attach to it. So if you poke somebody from the side, don't just go really crazy from the side here. That might hurt a lot because there's just some piece of bone that maybe you'll push, some muscle into. Good. And then from the rib itself, we have a few parts to it. So this is the parts that goes to the vertebra, or this is the part that goes to the vertebra. And you see the red goes to the red on the vertebra. So you see you have a head of a rib, this thing here that attaches to the body of the vertebra. And then we have a little region in between that's a little flatter. Usually it doesn't show as flat here, but it's often a little or narrower, and that's known as the neck. And then we have another bump, and that's known as the tubercle, and that's attached to the transverse process of the spine. So we have the head, the neck, and the tubercle. Very often with bones, if you got a head, you have a neck. And so, if you have to guess, use those kind of things to guess properly. Good. So that's what I have for this portion. Is that all kind of clear, or is that confusing?
That was clear for me.
Okay, good. So I assume if I don't get questions, I assume you understand. Otherwise, speak up. And you can always shoot me a text another time. That's totally cool too. A couple things I have this week. I want you guys to do the posture analysis. That's one of the health kit homeworks. And what I want you to do, it's described in here, but I want you to do is I want you to take a picture. And I did those myself, was putting the camera somewhere, the phone. Take a picture from the side and from the front and from the back, and have some landmarks that I point out. And I want you to visualize. You don't have to print out the picture. You just visualize it. If you can print it out, it's easier because you can make lines. But visualize it and then put your postural imbalances on this skeletal thing. Just draw it in. It probably is not that easy to find things. I still have sometimes hard times to see if my shoulder up a little bit or nothing, or my head forward or no. But it's a good exercise to start looking at that a little bit. And while we do the bony stuff, I want you guys to look at your bony framework a little bit. And so and then there's a couple of questions up here. So then when you've done that, you take a picture of that and upload that in the posture thing. And then the second page goes through because everybody has head forward posture, and pretty much everybody has rounded shoulders, especially now that we're all sitting on Zoom. And what I want you then to do is I want you to get through a basic exercise that's basically your head back and then the arm out. And I want you to do those stretches, stop them, of course, if they hurt, and shoot me a text so we can talk about it at least, or do them not too harshly with yourself. But I want you to do them 3 times a day for a whole week. I just decided that. That's not written down here. And then there's a little tracker, just so you can sort of feel that. Like you do an hour of study, you do a minute of stretching, and then that's 1 time. Don't go overboard at all. But I want to kind of get a sense because then we have a little sense, oh, like that's really kind of good. And I don't feel like grouchy. You know, now you're all 20 years old. When you're 50, oh boy, we still have to be flexible and happy and in good shape when we're 50 if you have to sit all the time. And so then when you've done that, there's a couple of questions here, and you take a picture of that and upload that as the second thing. And that's basically that posture thing. That good?
Yes.
Yep.
Sarah, got a question? No? Good. All right. And again, if you have a question, just shoot me a text. I'm available for that. Okay, then to close out, what I want you to do is a little quiz. So what I want you to do is take a little piece of paper out. And take the term list out. And I'm going to share my little photographs of that I have here. Uh-oh. Oh, I'm too cocky. Here they are. Can you see my skull coming up?
Yes.
Yes.
Good. So don't say the term, but write it down. As term number one, I want you to tell me, what is this bone called? This whole bone here in the front of the head. So that when I ask bone, I want the whole bone. So that's number one. Number two is in the back, not in the front of the skull. It's not the whole bone. I want you to tell me, what is the bump? That bump, there's a landmark. What is this landmark called? This landmark in the back of the skull. And it's a bump. You can feel it on yourself. And it's a three-letter word, a three-word term. Sorry about that. You can abbreviate it too. So that's number two, the bump at the back of the head. There it is. Now I can say it right. And number three is looking down at the skull. I see a big hole here at the spinal cord, or the brainstem actually goes up and down. What is that hole called? Number three. And then number four, I want you to tell me, what's the bone called? That's the cheekbone. That's number four, the cheekbone. And number five, go back to this one here. When I look at the skull from down, this is the front, this is the back. I have this indentation here that the pituitary gland sits in. At this point, I'll give you a little more hint. It's called, translated, the Turkish saddle, because it looks like a Turkish saddle. Again, that's when I think they had a lot of wine when they came up with these names. Turkish saddle, number five. And then we're going to go to the face a little bit. Number six, I want you to tell me, what's the round muscle that's around the eye? Number six, the round muscle around the eye. Number six. And number seven is a muscle that's from the corner of the mouth and goes downward. Corner of the mouth going downward. That's number seven. A muscle. Corner of the mouth down. And number 8 is a chewing muscle. The chewing muscle that goes from the zygomatic here goes downward on the mandible, basically, up and down. What's that chewing muscle called? That's number 8. Number 8. And then number 9. Where am I? Number 9. Here's a vertebra. The back bump on the vertebra. What is that bump called? That's the bump you could touch when you touch the back of your spine. What is that bump called? Number 9. Oh, look, it's also here. That's the bump. You can see how big that is. That's a lumbar vertebra. You see how wide that is. And then number 10. No rib. Bye-bye rib. Number 10. Oops. What's this bone called? What's this whole bone called? That's the visual, the picture from the back. And that's the picture from the front. That's good. All right. Now, solving the quiz, I want to hear as many shouting, name-saying words as possible from as many as you guys possible. I want you guys to vocalize the terminology. That helps also for us to memorize it better. So don't hold back. Just what is number 1? Everybody say it. What is number 1?
Frontal bone.
Frontal bone.
Frontal bone. I have 15 students. Come on, where are everybody? Frontal bone. What's number 2?
External
External
protuberance.
External occipital protuberance. Very good. You can also write down EOP next time. That makes it a little bit easier. That's sometimes we abbreviate these things. Number 3.
Foramen magnum.
Foramen magnum.
Magnum.
Foramen magnum.
Foramen magnum. Was that everybody? Almost, huh?
Wait, did you get Nelia? Sorry.
Yeah, I got you on roll. Mm-hmm.
Okay, thank you.
Oh, yeah. I don't see who's speaking out. I just want to make sure you all speak it out. When I don't get many voices, then when I'm really mean, I call on people. But don't worry, I haven't done that in a while. Now you're scared. No. What is the next one? Number 4.
Zygomatic.
Zygomatic.
Bone.
Zygomatic.
Zygomatic bone. Super. Zygomatic bone. And then number 5.
Sella
Sella turcica. Say it with me. Sella turcica.
Sella
turcica.
There you go. Sella turcica. Isn't that a beautiful name? You can guarantee it's on the test. It's too beautiful of a name. It's pure nerd speaking. Number 6.
Orbicularis.
Orbiculus oculi.
These are so hard to say.
It is. It's okay. I'm the one who's gotta, I had an English class in the fall I took, and we had to read Shakespeare on Zoom. And he's like, so who's gonna do roles? And I'm like, nobody was saying. I'm like, volunteer, because I speak all the time, but everybody else was. When he called on people, all of a sudden they were gone from Zoom. It was just.
I could easily read Shakespeare. These are harder for me.
Oh my God, that was just too funny. The embarrassing stuff that came out of my mouth when I was trying to read Shakespeare. I was sweating bad. Anyway, so this is Orbicularis oculi. Well, and Tenaya, that's another reason why I want you to speak them as much as we can, so we get used to this kind of weird language, right? Because a lot of it, you can basically voice it out. English is actually kind of weirder in terms of how it's written versus how it's pronounced. With these words, you can't really go wrong if you just word it out. All right. Anyway, so that was the Orbicularis oculi. Then we have this one down here. That's number 7.
Risorius.
Depressor Anguli Oris.
It's the Depressor Angularis. The Risorius goes back. That would be here, the Risorius. So that's let me show you. The Risorius here is easier to see. See where the yellow line is? That's a nerve. Underneath, that's the Risorius. And so the Depressor Anguli Oris is the one going down. The Risorius goes straight back, and the Zygomaticus is the one that goes upward. Yeah, they're all from the corner of the mouth. So that's Depressor Anguli Oris. Say it.
Depressor Anguli Oris.
There you go. And then number 8 is this one here on the side. What's that called?
Masseter.
Masseter.
That Masseter. Good. That's a little less of an esoteric name. And then number 9 is the tip of the back of the spine of the vertebra.
Spinous
Spinous process.
Spinous process. Good. And then number 10 is
Sacrum.
The coccyx.
the sacrum. I want the whole bone. The coccyx is down here, and the sacrum is the. I mean, yeah, I usually label it in here. So actually, coccyx is right too because I just had both of those bones here. Excellent. So sacrum. Say it's sacrum.
Sacrum.
Good. Good. Okay. Good. So that's not too bad. How was that for you guys?
Pretty good.
Okay. So it's. You feel like that's helpful if we do a little of that every time?
Yeah.
Good.
I have a
All
question.
right.
Is the coccyx, is that bone particularly fragile?
Yeah. It is a problematic situation when you fall on your butt.
You know, because I was thinking about it because, yeah, you know, it was something we sit on and we kind of just plop down on all the time.
Yeah. No, I mean, the whole sacroiliac, joint, the whole pelvis with the sacrum in between, especially the joint where those connections are. So if you do the force transfer from the legs into the spine and you have, like, let's say you lift something really heavy on one side, you put a lot more force on that right side or one side. And that can be problematic in that joint, especially if we had things like car accidents and things like that. Or falls onto it because they're very strong ligaments, but they're weak. They're weak. Once they are weakened, they are weak. So that's kind of an issue for also, after pregnancy, a lot of times they have loose ligaments and then those ligaments are kind of coming together a little bit crooked. And that creates a lot of back pain in post-pregnancy too for people. But yeah, falling on the coccyx is problematic because it pushes it to one side. Or if you sit on that for a long time, it also pushes it to one side potentially. And that can be...
And that's more so for adults, right? Because in kids and children, they have to their bones have to still...
Yeah, the kids are usually fine. The kids they're much more flexible than we are.
Right, exactly.
Yeah. But if, but I did have patients with coccyx things and it can be very debilitating thank God we don't have too much ice around here. That happens much more frequently in icy neighborhoods. Of course. Anybody else have a question?
So if we're starting the posture analysis and doing the little challenge with the exercises, if we start tomorrow, then it's okay to turn it in next.
I put it to the 14th. Thank you.
Okay.
I changed it to the 14th. And then next week I go through the home office evaluation. That's the health kit for that is in there. There's a home office thing. And I also have that the 14th because you don't have to really do anything in terms of tracking yourself. You just get your home office and see like, hey, a few checkpoints, but since we're all sitting down, I figured it's probably useful to do a little bit of that.
Okay.
And then, it's the right topic of sort of the bones and things like that. And so then that's also due on the 14th. But that's good.
Cool. Thank you.
Mm-hmm. Anybody else? Well, if that's the case, we might as well call roll and be good with it. I have Scarlett. Give me a live sign. I have Nita. I have Tanaya.
Here.
I have I have Koa. There's Koa.
Here.
I got Sarah.
Here.
I got Nelia. I got Caitlin.
Here.
I got Celeste. Do I have Vanery? There's Vanery.
Here.
I got Brianna.
Here.
I got Adam. I
Here.
got Lexi.
Here.
Kayla May.
Here.
And Abril. Do I? Yes.
Yeah, I'm here.
Super. Did I miss anybody? I don't think so, right? Good. Well, with that, I really appreciate you guys being part of it. I'm sorry it's a little lecture-y. Let me know if you have some ideas of maybe do some breakout sessions or something. I have some of my ideas. Sometimes they go well. Sometimes they're just people sitting in the room being quiet. So, you know, but, you know, always keep in mind to see what would help you guys to learn this material better. And with that, we can close it out. I wish you a wonderful
Thank
evening.
you.
Thank you.
Have a good one.
Thank you. You too.
Bye.
Good
Good night.
Bye-bye.